Okay, we're gonna go. Let's wait for LinkedIn. There's always a delay. Maybe on YouTube. Let's see. YouTube. Twitter. It's going on Twitter too. Very underrated, Monica, this Twitter. You don't have a Twitter, do you?
No, I don't. I have Twitter for global.
No, you need one for yourself. See, okay, it's working. We're live. So let's go. Let's go live. Let me put the volume down on this thing. So Monica doesn't have a Twitter, I just discovered. We need to change that. By the end of today, we need to change that.
I will have a Twitter then.
What's up, party people? What up, LinkedIn? What up, YouTube and Twitter? You need to follow me. You get on Twitter. Twitter's amazing. Twitter's that was my first social network before like when I started blogging besides YouTube. But Twitter was like you interact with people by text. You can do voice or video and image, but there's like an engaged conversation. You want conversations? LinkedIn's also a great place for this, but Twitter is a little bit more casual, but still engaged. And if you like news and politics and you want to get news quickly, Twitter is the fastest way to get news. So what's up, people? How's it going? Can you guys hear us? Let me turn on the volume. It's like engaged. Yes, we do have volume. We're evolving with this. So let's see if on YouTube we're on there. So what do you have to say today, Monica? What's going on?
Okay, so we are doing this live presentation today.
Live stream.
Yeah, live streaming today because we want to speak about our CRC Academy.
Yeah, Chris Sims, I see you on YouTube. We're on everywhere right now. I see you on YouTube. We've got to have you. Your people love your interviews. We got to have you guest lecture CRA Academy. We're gonna have to do that this quarter sometime. Maybe text me, man. It would be an honor, and you're gonna help so many of our students. You're already their hero. So message me or text me, and we'll set that up for you in the next month or two to guest lecture. You're like a hero to people. Chris Sims. Hello, everybody else on YouTube. How's it going? Let me know on YouTube if you like these live streams. Let me know on LinkedIn what is going on. And then on Twitter, I mean, I'm not even monitoring it, but what's up, guys? Like, how's it going? Leave comments, retweets. On YouTube, hit the bell. On LinkedIn, I don't know what you do. Just like it and then share. Share. Let's get people. So, sorry to interrupt, Monica, but I got excited. I saw Chris on here. Chris Sims. Not Chris Sauber.
When you were talking about Chris, I was just like, oh, I thought you were talking about me. And I just like, oh, thank you, Dan.
Oh, Monica is people's hero. You are people's hero. Let's explain something, okay? We just finished the first CRC Academy.
Yes.
Right? I maybe joined a few times. I interact with the students on Slack. We have a Slack, so I interact with them there. This next quarter, I plan to. Well, it's not quarter anymore. Actually, we have a special announcement, right?
Yeah.
It's every month.
It's gonna be every month.
So the first week of every month, we're starting a study coordinator, clinical research coordinator academy. I will be more involved in the next ones. The last one was weird because it was the first one, and then it was the holidays. There was a lot of distractions, but you're talking about being a hero. You are those students' hero. Those people love you. We're not even posting the stuff they're saying.
Yeah. But we're going to be interviewing them.
Oh, you will be. I can't wait for this.
Yeah.
It'll be nice to watch you interview someone and I'm not even involved.
Yeah.
That'll be amazing because you are those people's heroes in CRC Academy.
Yeah, I'm glad they like me a lot.
What's up, YouTube? Let me know in the comments what you think about Monica. And on LinkedIn, people know you now. So let's explain. What was the reason for every month CRC Academy? Because I know what it was for me, man. It was your idea. This CRC Academy, we're partners on it. We own it together with Chris. But it was really your idea. This is your baby.
Yeah.
right?
So what happens is because we know the shortage is huge in the industry. Plus, a lot of people keeps on asking us about the classes, and because it's been very popular, due to the popularity, we decided to start doing it every month, so we can give the opportunity to people. I mean, in a shorter period to get into the class, because if you have to wait a quarter to get into the next one, then it's probably going to be too long. And on top of that, the classes are getting quite busy. So, um, and the thing is, we are striving to get these classes small, just to give more attention to the students.
There's a hero. We're not going to talk about it, but I'm interviewing this gentleman right here
Okay.
in an hour. Okay.
Oh.
I'll give him a shout out later because I don't know if he wants to keep it private right now. But if you're in the comments on LinkedIn, you know who you are. Amazing. We're in the CRA Academy. We have that too.
Oh, I know.
We're in week 2
And he already got
of
hired.
a 12-week course, and he already got hired. Amazing.
Yeah, but that's also good because the academies, our academies, are just rocking.
That's right.
So, if you want to skyrocket your career, and if you really want to join this elite industry, this is the way to go.
Now, the other day I was talking about soft skills for people in research, and people were asking, okay, what is a soft skill? How, for example, Dan, how can, and there's this mentality for CRAs that they're policemen and women. Well, that's not the case. Some people even post like they're proud that they are, and I tell them, like, I get it, you're trying to be funny, but hopefully you're not like a bad cop, is what I say.
Yeah.
But soft skills, I'm telling you guys, once this technology happens, where the algorithm's gonna do better than you at finding stuff, mostly. What's gonna boil down to is getting sight to buy in to do things, right? Influence, like that book we're reading, both reading right now. Never Split the Difference. I've got a video coming out on that book and how it could be related to clinical researchers. But we can go on forever about this because to learn soft skills in research, and then people ask me, well, what's an example? Well, basically, it's influencing somebody to do something that you want.
Exactly.
Right?
And for the CRCs and the CRAs, the relationship should be more like teamwork than anything else. Because at the end of the day, if the study goes well in the site, it's because the site has a great CRC, a good CRC, and on top of that, has a good relationship and is following what the CRA is saying. But if the CRA is mean and is trying to get things on the rough side,
no empathy.
it's not going to work.
No empathy.
And the same thing is going to happen with the CRC. If the CRC has a really bad relationship with the CRA, things are not going to work well too.
And it's not just us saying this stuff. I mean, you can talk to these sponsors who, at the end of the day, let's not forget what a sponsor is. They're sponsor. They're paying for the studies. What does that mean? They're paying for the CRA's fee. So when you have a CRA that doesn't have empathy, has no soft skills, okay, the quality of the data might be great, but at the end of the day, you're not getting any buy-in from the site. You know, I know monitors like this, very good monitors, but zero empathy, and then what ultimately happens is the site gets upset and stops enrolling because they don't want to deal with this person. So the sponsors are starting to know this, like, hey, we can't have this happen. This is like counterproductive to what we're trying to do. We're trying to monitor a study, we're trying to get the data, all right, and then we have these monitors that don't understand soft skills, and they're not teaching these things. And in this, I'm saying all this because not only in the CRA Academy, we do teach CRA in the CRA Academy, in the internship, exactly how to interact with sites because they're going to get a chance to interact with sites. But in the CRC Academy, you're teaching this stuff in the weekly webinars.
Yes.
but from the perspective of a CRC. So it's the same thing, right? Influence, tactical empathy. The CRC needs to convince the PI to do stuff, sometimes the sponsors to do stuff, sometimes the patients to do stuff, sometimes CRAs. So these are all important skills that I actually think CRCs are more equipped to handle. You want to talk a little bit about that?
Yeah, and I mean, just remember that CRC is kind of the glue for everything because it's the good if the CRC doesn't have a good relationship also with the PI, I mean, it's terrible. At the same time with the sponsor, which is the CRA, and remember that if you don't have a good relationship also with your CRA, then or a pleasant relationship with your CRA,
That's right.
then in the future you're going to be preventing your site from getting studies from them because they write how you say
I'm pulling up Periscope right now.
yeah, they write this
Note to file?
no, after they come to visit.
Oh, the report.
The report.
The
They
monitoring
write the
report.
reports.
Every CRA
And
Academy student learns that.
yeah, so they write the report on what happened. They are going to not to say very nice things about your site. So that means they're kind of putting you in the black book. You don't want that. So for this, a CRC needs to have a good relationship with the CRA at all times, and obviously with the patients, because if you don't have good relationship with the patients can stop coming, and if you don't have patients, then there is no money coming in the study.
Okay, so we got a question. We got a question from YouTube. And if you're in LinkedIn, put your questions. Twitter, I'm on you now. I'm there now. So, how do we establish good relationship with CRA as a coordinator? Monica does this. Monica does this better than anyone I know.
So to establish a good relationship with your CRAs, just treat them as peers. Like for example, when they initially come, just like any other relationship when you do networking. So when they initially come, I introduce myself. I tell them, look, we're here to help. We're just open to work together. And obviously we sometimes offer them coffee and be nice, just be nice, and establish a genuine relationship.
Mhm.
Is just break the ice. That's what you need to do, break the ice. And we have so many CRAs that in the past I have heard that they hear that they have that they are not easygoing or they're difficult. But we have never, honestly, since I've been working here, I have never had a bad relationship with not even one CRA.
This is actually true, and me and Chris discuss how amazing this is because that's not the case with me. But I haven't been a coordinator in years now. But when I was a coordinator, I didn't really understand all these soft skills. When like in my 20s, I didn't understand. It was really in my 30s that I understood. So if you're in your 20s, right, I mean, there's no right age to learn this. It's now. Learn it now because these are life skills that you're going to use. And that doesn't mean that you can get your way with just being nice to people. You still have to do your job and do it well. But really, like, to establish a good relationship with a CRA is probably tough as a coordinator, um, outside of just doing what they want you to do. But sometimes if you run across a bully, there are those bully CRAs. It's going to be extremely difficult, and it's going to test you.
Yeah, but try to break the ice always. I always try to relate to them. So I start talking to them and find out what's what could be something that we can relate to, and that's your opportunity. That's
Yes.
what I always do. I mean, and it works. It has worked every time, and not just with the CRAs, but with people in general. It's important to learn how to have good relationships in work in general, no?
Absolutely. It's
Yeah.
gonna. If you're on LinkedIn, you need to like this and share. We get. We can do this for as long as we can go. I have a site owner academy at noon, so we can go 20 more minutes. But let us know what questions you have on YouTube, on LinkedIn. Like, share, so that we get other people in here. Um,
We're actually going today to
A chamber of
a
commerce.
chamber of commerce, and we're going to meet with people from the Carnegie
Dale
organization.
Carnegie Institute.
Exactly.
Dale Carnegie Institute.
So that book is really good to to
Yes,
learn
that is a
relationships.
great book, but this
Yeah.
one is okay. That's a classic. How to Win Friends and Influence People.
Yeah,
But
that's
let me
one
guys
that
show
everybody
you.
should be reading about
Let
that.
me guys show you what you should be reading. Like what I'm currently reading. I'm gonna about to read it again. Okay. Never split the difference.
Yeah, that's a great book.
Okay, I have actually a video on this, particularly how CRAs and researchers can use this. But when you're a coordinator, okay, and you're building your soft skills, and coordinators interact with patients, so it's actually even more important that they do this. Your biggest challenge will be the patients or the PI or the sub-Is.
Having a good relationship with the patients also is like an investment, because what happens is if the patient likes you and you create rapport with the patient and the patient continues coming for the whole study, that's when you're it's a win for you. And
That's right.
obviously a win for the study and a win for the patient. But if you have a bad relationship with the patients and you treat them like numbers, what's going to happen? The retention program is not very good in your clinic then. So that's something that you guys really need to work as a clinical researcher.
And you know the best part, like if you want people want to make this selfish, because I don't blame you. If you want to learn soft skills, okay, everybody has to learn the fundamentals, the hard skills of their job. That's just requirement. What goes without being said. You have to know how to do your job, the fundamentals, and more than the fundamentals. All right, but pretty soon, and who knows when, 10, 20, 30 years, algorithms will do this because we're moving into data. The jobs will all evolve because machines will do a lot of the grunt work. But the soft skill will be even more important because what happens with data is you have a lot of people being overwhelmed with this data, and then even more pressure, honestly. Even more is expected of you to do. Even more would be expected of a coordinator in that environment because there's more data. So a coordinator is going to be expected to do more. You think entering your data now and responding to queries is hard now when it's mostly a human being triggering your queries? Wait till a machine is doing that nonstop. Okay, so somebody, and it's not going to be a machine, has to learn soft skills, and these are going to be the people that are going to be employable in the next 2 decades. Maybe you can get away with it now. We're not there yet, technology-wise. But in the future, I really believe it's going to be soft skills, creativity, all these things are going to be the most important. The fundamentals will be there. You're still going to have to know that stuff. The role of a CRA and a CRC will be the same but different.
Yeah.
I mean, that's just the way it is, you know. And if you think about it, the role of those two people, CRA and CRC, are different than it was 20 years ago. I mean, now we're getting more of these electronic systems, right? In the past, 20 years ago, there was no EDC.
No, everything was just
You didn't have to know how to use a computer to be a coordinator or a CRA 20 years ago. Now it's a must. So the skills change like the job changes. It just changes slowly, you don't notice it. But it's changing ever more so as we get into big data and analytics. I really believe you should invest in your soft skills. You should invest in, I can't show this, but you should invest in learning about other therapeutic indications. I did yesterday, the people I put you in touch with to network, Topaz Clinical Research, one of the best interviews I ever did. It was like an hour and a half. It's going to be going on YouTube YouTube and the podcast this Monday. And man, like the story is so good of how they started their site. But they're hiring people like interning. Okay, they allow interns, but you have to show them that you can provide some value to them.
of course.
You can't just show up and say I want to intern. Okay, like in the CRC Academy, we do this for you, for our graduates, and in the CRA Academy, we set you up with the internship. So the value is to them, to the employer, that we trained you, so you know what you're doing. But if you go a different route without us, it's still possible. But you have to go in knowing how to do something and showing them. You can go to clinicaltrials.gov and tell that site, hey, I don't have any research experience, but I watched Dan's video and he taught me how to look for studies on clinicaltrials.gov. If I do that for you, can I also intern here? Because I want to learn research. Who would say no to this?
Of course.
Nobody. I'm sure somebody would, but most people will not say no.
Yeah.
But most people will say no if you just show up and say, hey, I want to intern here. I mean, what are you going to do? You know, you have to put yourself, again, another soft skill. Put yourself in the other person's shoes. Put yourself in the other person's situation. Why should they, even the Topaz Clinical Research said when they had interns in the past, they would just allow anybody to come in. They wasted the entire day training these people and missed out on their real work. So you've got to be a value add. Okay, that's requires empathy to put yourself in the employer's shoes. Another thing you can do, recruit patients. I mean, we talk about this all the time, Monica. That's where you started in research, patient recruitment. I understand that's the most difficult, but it's also the biggest need for sites, right? Another one might be building a website, or now we're in a 2020 world, managing a site's Instagram or Facebook.
Yeah.
Right? Sites don't really have time for this stuff, or like doing a podcast or setting up a blog. These are things interns can do. In exchange for that, and whatever your skills are, everybody has different skills. So these are things, but going on clinicaltrials.gov and looking for studies, anybody can do. And we have an hour-long video on this. So this is what I guess the point of this live stream is. It's not just to talk about CRC Academy, which is now every month, first of the month, $3,000 every class internship, or the CRA Academy, which is every quarter, $4,000. But in there, we offer an oncology internship. In 2 weeks, I have 4 interns coming out, and they're going to spend Monday through Wednesday with Chris, going through the site level, like basic training. And then Thursday and Friday, they're going with me to LA to monitor a real study for oncology. And they're going to write the reports, they're going to do the follow-up letter, all that stuff. So we're excited to talk about those things, but I'm going to make sure, and I have been making sure, that, and Chris always tells the students, you don't want to be like a cop when you're a monitor, because you're not going to get the sites to buy in. And the same thing when you're a coordinator. I know some CRAs that are really nice people, and then the coordinators are jerks. It's the same thing.
It's exactly the same thing. Now that you mentioned that about the internship with the CRAs, I don't know if you ever mentioned in one of these stream videos if that we also have in the CRC Academy the final project.
No, you did not mention that.
The final project is so nice. It's a real life scenario with a specific timing to like the same period of time that is being used to get a study from the beginning until the time where you get the SID. So I show you all the material.
We've done. It's amazing what the final in the CRA Academy. It's harder. We have a final exam. We have quiz, midterms. But in CRC, it makes sense because you're teaching. See, CRC is much more of a generalist than a specialist, and we talk about this all the time. In the interview with Topaz Clinical Research, we discussed that as well. You know, being a generalist, in addition to creating empathy skills for the next few decades, the next most important thing will be learning how to become a generalist, learning how to become a multi-specialist. So the owner of Topaz Clinical Research, she was a CRA for 15 years before she opened her site. And she was smart enough, even back then, when nobody was talking about this, because CRAs were even more shorter in demand or in supply. They were even higher in demand back then. She learned a particular therapeutic indication because she was assigned to that indication. But she told me something very interesting, and a lot of CRAs out there watching, or people that are about to be CRAs, did you know that at most CROs, let's say you're a CRA and you're in psych, okay?
Mm-hmm.
So like they just train you on psych. You have to do a bunch of psych trainings. This is a training here for ulcerative colitis that I'm doing, where I'm a contract CRA too. So they give you these trainings for the studies you're monitoring.
Mm-hmm.
That's basic, okay? You want to take it one level above. They also open all the other trainings of indications to the CRA.
Oh wow! I mean, that's a
All
great
of them.
opportunity to learn everything.
But how many do this? Very few. And then they ask me how to become a generalist. And it's like, it's right there.
Yeah, our class is for. I mean, it creates students that are generalists. We teach from A to Z how to do. You pretty much will be able to run the show completely because you will know how to get studies, how to negotiate them, how to do everything like the how to do the read all the protocol, do the source documents. I mean, you name it, every single thing. And then on top of that, besides the final project, we also have the week of like a small internship where they come to the site and experience a real life week in a site, in a real site. So, I mean, it's not a brainer. We have everything in the CRC Academy and also the CRA
The
Academy.
tools, bottom line, the tools are out there for everyone. Most of the CROs offer, the training portal is the same thing for everybody, for every indication.
Mm-hmm.
They just tell you, okay, these ones you have to do these ones because this is what you're monitoring. But in your spare time, if you want to be a generalist, I don't know, for whatever reason, maybe you want to protect yourself in the next downturn, you learn, they're there. And then guess what? They have certificates you print.
Wow,
Nobody's going to be upset
great.
that you're doing that. And if you don't have that, maybe you're at a small CRO, they don't do that, ask. Say, hey, in my spare time, I would love to learn about oncology. Do you have training? Can I do the trainings for you? Who wouldn't want that? You're basically telling them now I'm preparing myself to be a backup for oncology in case one of your CRAs leaves,
Yeah, and then
which they leave all the time.
and then what if in the future you have the opportunity to go and get a very nice study that you didn't have the experience, but you already have the training.
That's right.
So,
That's
I
right.
mean, you're opening more doors for yourself.
And learning, becoming a generalist in the therapeutic indication sense of becoming a generalist. So you're basically becoming a multi-specialist. Okay, becoming a generalist in therapeutic area is much easier than becoming generalist for job functions. It's much easier. You're gonna have to do a lot more work to figure out if you're a coordinator and you want to learn about data management or you want to learn about regulatory affairs. I mean, the regulatory binder, the investigator site file, is just one aspect of it. Regulatory affairs is more about roadmaps, what the FDA wants to see, what kind of INDs you need, all that stuff. That's going to be harder. You're going to get that through networking. You're going to get that through Googling. You're going to get that through taking trainings. So one of the things we pride ourselves on for both of our academies, CRC and CRA, we're making generalists. Like the things we do, it's very strategic the way we design the courses. It's you're going to be a generalist.
Yeah.
And in the hardest thing possible, which is the different job functions.
So you get the opportunity to apply for many different type of jobs within the same industry.
Yeah, the idea to be a generalist, I love this idea. It's not even an idea; it's a survival skill. You know, it's like survival of the fittest.
Mm-hmm.
The job market is great right now, guys. What do we do if in 2025 it's horrible? What if it happens like 2008 and your only skill is one little thing at a CRO that's no longer needed, or your only skill is in an indication that's going to go through a drought?
Yeah, wow.
I mean,
That's
you're in
scary.
trouble.
That's scary.
You're in trouble.
It's
Whether you do academy or not, you're in trouble if you don't take the initiative for yourself. You are responsible for your own success. And yeah, so I had somebody comment on one of my things. I'm not gonna mention their name, but I'm gonna read one of the comments because this is the mentality that's out there, and it's I understand what they're saying, but I don't agree. So I'm gonna find it. It might take a while. In the meantime, what's going on? Hola, hola, Monica. Flor Falguera. ¿Dónde estás, Flor?
Hola. Hola, Flor.
Colombia? Maybe?
Hey.
Who knows? I'm gonna find this quote. See, I posted this a while
Yeah, I
ago.
guess I remember that.
I forgot, but the guy, somebody, I said I posted a picture like be a generalist, which is actually a multi-specialist. So people who don't like this idea think, oh, well, you're gonna go from being an expert in one field to just being not an expert in many fields. It's not entirely true. The way I'm saying it is you need to become a specialist, a multi-specialist. Right? So once you master a therapeutic indication, go to the next one, and go to the next one, and go to the next one. And you may not be as proficient as somebody else who only does one thing, but for your career, it's much better long term. And this person's argument was, well, sponsors hire you to be a specialist. And I get it, that's fair. But you're only seeing half of it, okay? You're right, sponsors are hiring you because you know how to do this. But what happens when what you know how to do is irrelevant? That sponsor's not going to help you then.
No, they don't want to care. The only
No.
one that cares to open your own doors is yourself. So.
Australia. Oh, that's good, Flor.
Oh, you
Good,
know
buddy.
who Flor is. Flor, I spoke to
Oh,
her.
I did too. We had an email.
Yeah.
We had a long email.
Yeah, I spoke to
I
her.
remember.
On Friday. Hi.
Luke Eddington from Data Farm, Australia.
She's actually in the Gold Coast.
Where's that? So not by Sydney.
No, Gold Coast is like Miami in Australia.
Wow. Must be nice.
Oh.
Must be nice. So what do you guys think? I mean, LinkedIn's been quiet. Maybe it's too early. Usually we have way more people. Maybe people are worried about coronavirus. What you should be worried about is your career. That's deadlier if you are if you're not a generalist. That could be more deadly, more dangerous than coronavirus for you.
Okay. Yeah.
For you.
And then right now, the industry is booming and there are a lot of opportunities, but it's not always the case. So it's better to be generalist, definitely, and open the doors, more doors for yourself.
Yes. There's an echo on the live stream on YouTube. Darn it. I don't know how we have the echo. But there's an echo. I apologize, YouTube. We're figuring this out. We gotta figure this out. LinkedIn, any echo? Can you hear echo? Echo, echo. Does this mean looking for CRC jobs we should be learning this skill? Yes. You should be learning everything it needs to be a CRC. You should be learning all the skills that entails.
And remember that CRCs also have a specialization in different therapeutic areas like oncology, psychiatry, general type of studies.
Yeah.
So yes, the answer is yes.
The answer is yes. And if you're looking for a job, the biggest thing is experience. The biggest thing. Everybody wants experience. And there's really no way to get started without experience unless you get lucky. Well, or you have something, a skill, that site likes. You know, Topaz research yesterday, we talked about it. It's not enough for their coordinators to be experts at a therapeutic indication, which they have. Their coordinator is a neonatal nurse, and they do pediatric and infant studies. She's also a master salesperson, according to them.
Yeah, I remember
according
that.
to them.
Yeah.
So, you know what? I mean, if you need the experience, you need to go intern. So taking it back to where we started, everybody has something to offer to a site. You just need to put yourself in the other person's shoes. Okay, why would they want you there?
In other words, you want to offer them an advantage uh, of hiring you or having you as an internship, like a competitive advantage over everybody else. So you have to find out what's your competitive advantage and offer it.
What do you guys think? YouTube, LinkedIn? I don't. Maybe we can't see comments
Let me see.
because I put two comments in there and it's not showing up.
Oh yeah,
Let's
generally.
go through all these comments.
Hello,
Go through
Dan.
all these comments. Somehow we missed them.
Okay, so Raul says hi, Dan and Monica. Hi, Raul. Then Jesslyn. Hi, Jesslyn. Actually, I need to talk to you, Jesslyn.
Oh yeah, Jeslyn. I've been sending you people left and right. There's
Yeah.
there's tons of people, semi-experienced, very experienced, no experience, to you. Um, yeah, we're still alive. Don't worry. It's just my LinkedIn's crashing right now. What else? There are no more comments. Just that's it.
Yeah,
So we
no,
didn't miss
that's what it.
anything.
Let me see. No, I don't see any more.
Okay. Well, we got 3 minutes left before I gotta get on the Site Owner Academy. Um, Patreon.com/Dan Sfera. $5 a month. You're gonna learn career development, digital marketing, social media marketing, business, entrepreneurship, basically everything not clinical research, but you can apply to anything. And of course, most of you are wanting to apply it to clinical research. So we're going to Chamber of Commerce next,
Yay!
right?
Yeah, I found. We have more messages. Jocelyn. Hi, Jocelyn. Christopher Sims.
Oh, I love this guy.
Hey,
Chris Sims, you're a
Dan.
hero.
Alexandra Safronova. I guess I pronounced it properly. Hi, everyone. Hi,
Zhao is a hero.
Philip, Joao,
Talk to you soon.
Perella,
Talk to you soon, man.
Jill Grison, Lurius Eugene, Eduardo. Oh, he's a French CRA.
Oh, oui.
Eduardo, yeah.
Jeslin's working on
from
it.
Madrid, Spain. MO. Hi, Madrid.
I talked to a sponsor from Barcelona yesterday. They're looking for a CRO.
Oh, wow.
And I sent them our slide deck and a budget. And I told him I'll do anything for a free trip to Barcelona.
Wow, me
Yeah.
too. Wow,
Well,
take
you'll
me,
be involved.
please.
Yes, of course.
Jinka Patel, Jim Choi, and Chiamako from Georgia.
Oh yeah, I know all you guys. A little echo, but no worries. Yeah, next time I change the mic, there's a different mic I could use. But this live streaming thing is not that easy. It's actually very easy on YouTube and on Twitter. So I'll vent right now. YouTube and Twitter, so easy. You can live stream from your phone, just from the app, just from the YouTube app, from the Periscope app, which is Twitter. On LinkedIn, you can't do this.
Oh, I guess it's better new. They just probably will be making it better
Yes,
and better.
LinkedIn Live is in beta mode. Luckily, I'm lucky enough. I have to use it once a month. I'm lucky enough they let me use it, but it's just so cumbersome. And then it's making all these cameras and mics not sync up. I wish LinkedIn I can just live stream from the app, because I would just do a live stream for I'd have 3 devices here, and just live stream from all of them. It's much easier than this. So LinkedIn, if you know somebody work at LinkedIn, let's show them this last part, because we need to fix this. What's going on here?
Yeah.
Anything else? That's it. We gotta do Site Owner Academy.
Yeah.
Monica's been getting a lot of studies too. If you want to network, I'll end it with this. My new title for 2020 is Chief Networking Officer. Okay. Chris told me I have to do this because we need studies. We need to network with people for different things. I don't care what you need. in this industry, text me 949-415-6256. Let me know how I can help, and then we'll figure out how you can help.
Yeah, let's network. I'm gonna give my phone number too.
Okay,
714-561-6366, or email me to monica@globalclinicaltrials.org or monica@thecrcacademy.com.
And we got one more question. Okay, then we'll go, because I gotta go. We can do this all day. In the lab, we receive all the samples for PK analysis. However, for those studies that are not blinded, sometimes the sponsor requests not to extract samples for placebo subjects. Is that common? No. The sponsor doesn't seem like they know what they're doing, or they're trying to cut corners. I mean, the sponsor's not blinded, right? Like, they know. But everyone who works on the study and reviews the study is blinded, right? So that sounds a little bit weird, unless I'm not understanding it
They
properly.
probably don't want to pay extra.
Yeah. But anyways, guys, I gotta go. I'm already a minute late, so we're gonna catch you all later.
Thank you all.
Text, message, Chief Networking Officer. Let's go.